Welcome, I'm Becky Kaiser here at Hayes Med to talk about coronavirus with some health specialists in our community. These are questions that have been coming from you on social media, also to the hotline at Hayes Med. And of course, Hayes Med is part of the University of Kansas Health System. We're doing this today because we want you to know about what the health situation is in Ellis County, who the experts are that you can turn to for the answers that you need as we talk about the COVID-19 virus, also the hotline that is available to you at Hayes Med, and what questions have been asked from patients around the area. Now with us is Dr. Tonya Knoll, who is actually the medical director for Ellis County Public Health. And Dr. Knoll, that might initially confuse people, your title, because they might be thinking of the Ellis County Health Department. What is the difference between the two, and what is your role exactly?
Well, as director of the health department, I try to help spread information, give information to the community at large, and especially with the recent coronavirus issues, and try to calm the community because it's really important that they have information. Information is key, and so we need to maintain calm in this situation and try not to panic over everything. And so that's kind of where I help out and help with community services that aren't met by some of the other practices around town.
And this is one of the resources that we have available to us that we should trust. Dr. Fisher was talking about, stay off your social media devices or away from that, and be looking for things from the Kansas Department of Health. Now I just forgot the name of it. Kansas Department of
Health and Environment.
Health and Environment. There we go, KDHE. And then also, of course, nationally, CDC, because those are the people who have the facts, and you are utilizing their information as well.
Absolutely. The first thing I'll tell someone when they call with anxiety about the situation is turn off your TV, turn off the media, and just get the facts from a trusted professional.
And I think that's also, particularly with social media, I have seen some things out there. Honestly, I saw one at the beginning of this pandemic that was sent to me by a friend on Facebook, and it was about somebody supposedly who was a medical person saying eating bananas will kill the coronavirus. And I was surprised that my friend would even pass something along like that. But we know people are seeing those kinds of things, and they need to make sure what they see is legitimate.
Absolutely. Fact check your things, especially Facebook posts. Fact check it.
Well, let's talk about Ellis County in general. I understand that there is a task force that's been put together, and along with you and Hayes Med and other health practitioners, we're getting information out to critical services that must continue even though we are under a stay-at-home order.
Correct, and we just need to be prepared. That's the most important part of this whole thing, is that we're ready if and possibly when it occurs. And I do feel we are very well prepared in this community.
How often do you talk about this? How often do you get together?
Oh, as far as meetings, we're constantly texting, phone calls. We meet several times via teleprompt, Zoom, things like that. So we're in touch on almost a daily basis as far as practitioners and people who work for the Ellis County Health Department.
Because things are changing pretty rapidly.
By the hour.
By the hour. Well, let's talk a little bit about social distancing. You and I are sitting the 6 foot apart, and what do we mean by social distancing exactly? The 6 foot number keeps getting thrown around.
Yes, well, actually, social distancing and close contact are two a little bit separate concepts. The social distancing is something where you try to prevent people from running into other people in public situations as much as possible. And so you want to try to stay home if you can. That's why they shut down schools and try to do, work from home type things to help from spreading the virus. It has been shown that social distancing does help the spread of infections that are respiratory in nature, which COVID-19 is respiratory as far as the droplets.
And most recently, I've seen information from KDHE that we haven't done that huge, flattening the curve is what they're calling it, that we don't have that huge spike, and that by social distancing it seems to be working at this point.
Yes, studies are showing in other countries that social distancing is actually working and helping, so we don't overtax our medical system.
We talked with Dr. Fisher a little bit about this. There are times when we will need to go out into public, and groceries come to mind. Many places are changing how they're serving public and bringing things to you or setting them out so that you can get it yourself. But is it necessary, because this is caused by a respiratory system failure, so to speak, do we need to be wearing face masks when we go out in public?
I actually don't feel it's necessary. First of all, the typical masks that you see don't actually protect fully from the coronavirus. They're also loose fitting to the face. So it doesn't do much in that respect. If you are coughing or feel ill, or your healthcare provider tells you you should wear one, then it may be acceptable. However, I feel that if you're sick enough that you think you need the mask, you probably should stay home. The other part is that they do say that it may help you remember not to touch your face as much. People typically touch their face 52 times a day. With the mask, it may remind you, however, if you do touch the mask, then you're infecting your hands. And if you don't wear them properly, don't know how to take them off and dispose of them properly, this could also cause increased contamination and a false sense of security, because it really doesn't fully protect from other people. It's more to protect you from coughing and spreading your droplets somewhere else.
Yeah, good to know. One other question that has been coming into through social media, through the Hayes Med hotline, people were curious about their pets, and many people working at home now, and so they're around their pets more. Is there a possibility that pets could become infected with coronavirus?
Well, there's never a 100% chance that something can't happen. However, no studies have shown that you can transfer this to your pets or vice versa. I mean, there are some things popping up on social media where this cat or dog may have tested positive. However, there are no confirmations. There are still more tests that need to be done before they say that happens. And they're doing some pretty large studies right now in Korea showing that there's absolutely zero transmission in a study of 2,500 animals. So I really think it's okay to be with your pet. However, if you do come down with the virus, you might want to isolate. And you should always wash your hands anyway after handling your pet.
Good reminder. And you know, we've also been seeing, and those of us who have pets know this, they can be very reassuring and kind of help calm you when you are feeling a little agitated.
Absolutely. You need your pets at this time.
I agree.
Best anxiety relief there is.
Okay, thank you, Dr. Knoll.